So, Lord Lieutenant, thank you so much for joining me today for my little chat with one of our local dignitaries. It's lovely to meet you. Is it okay if I call you Peaches?
Oh, yes, please do. Please
Oh,
do.
thank you. So I'm Evelyn. I'm the Chief Executive here at North Bristol Trust. So thank you, as I say, for joining me. Now, I believe you've been here at Southmead for a vaccination just earlier this week.
I have. I'm really delighted to say I'm taking part in that COM-COV heterologous vaccine trial. I think it's really exciting. Yes.
Oh, gosh. And how are you feeling?
Do you know, I did not feel a thing really for the injection. I had a little tiny bit of site pain, but I mean, that's only to be expected. But I've felt great ever since.
Great. I had my second jab myself yesterday, and other than just a slight tingly feeling this morning, I was absolutely fine. So I'm second dosed and I'm really feeling good. So great.
Oh, that's
So
wonderful.
the trial, you're not worried about being in a trial rather than in the standard treatment phase?
Well, I actually postponed my vaccine to be able to take part in the trial. That's how keen I am to do it. I think it's fairly clear that the AstraZeneca and the Pfizer vaccines are safe. Look, we've had how many millions of adults, older adults, that have been vaccinated. There haven't been any problems. So
Yeah.
I think the trial will increase the flexibility of use of vaccines, not just here in the UK, but right around the world. And it's something that I'm just really proud to be taking part in.
Oh, well done, you. Oh, I'm really pleased, and it's great that you're doing this. So clearly, you know, we have sensed that there's a growing concern. There has been a concern for some of our colleagues, BAME colleagues, that maybe the vaccine isn't safe. And clearly, a message from you about how good it is to actually participate and be involved in the vaccine would be great to hear.
Well, I have heard lots of stories about people being hesitant to take the vaccine for a whole number of reasons. I don't think there's any reason to give credibility to any of the myths that are circulating because they are myths. What we have is very clear evidence based on individuals that have taken part both in trials, and I did the research which looked at how many people of minority ethnicity took part in the original clinical trials for both of the vaccines,
Okay.
and saw that there were robust numbers in that. And I also feel that, you know, unless we take care of ourselves by taking the vaccine, you know, we're just going to make problems, I
Yeah.
think.
And
So
it's about our
it's very easy. There is no reason why at all people should be concerned about taking the vaccine. All of the evidence I've read, and I must say that I'm a biologist, so
ah,
I'm not just just saying that because
good.
I've heard it somewhere, but I can also read the papers.
And I'm an ex-pharmacist as well, so I fully support what you've just said.
Oh, that's wonderful. Oh,
Yeah,
good.
great. So listen, just finally, we've got a lot of our teams are working really hard out in the community with the mass vaccination centre down at Ashton Gate, and we've got our hospital hubs running here. NBT are the lead provider. But again, we've got a real cadre of people out there getting the message out there. So it's really important to have your support. So we've got pop-up vaccination centres being set up for some of our asylum seekers in the hotel, in the mosque here at Southmead, and some other pop-ups coming along down at St Paul's and I think it's Easton as well and Barton Hill. So there's a number of other areas that we're trying to reach out to other communities. So that's the kind of message we're trying to get across. So if you're
I think
out and about, please pass it on.
that's very encouraging because once you're in communities, you have an opportunity to talk to people about their fears, their concerns, but most of all, you can talk to them about the efficacy. You know,
Yeah.
these vaccines are incredibly, you know, I cannot remember a time when any vaccine has really had the level of effectiveness as these ones. Normally, we're delighted when they have 60% effectiveness, and
Yeah.
what we're talking about now with the AstraZeneca and the Pfizer vaccines, both, you know, up into the 80s, 90s,
Yeah.
that's almost unheard of, isn't it?
Absolutely. And, you know, we all watch the news every night and we're all seeing the rate of decline of admissions to hospitals, which is great. So, you know, over what, 17 or 18 million people across the country vaccinated. So you're one of them now. So
Oh, yes. And I hear you've had your second jab already.
yeah,
So
just
that's
yesterday.
wonderful too.
Yeah, great. So listen, thank you so much for spending the time to talk with me today. And I do love your little garden behind you. It's just, the colours are just beautiful.